Hello dear viewers, once again, so welcome to my lecture. Okay, so if you remember, so we have already talked about the different antifungal agents, drug use in the treatment of variety of infections which is caused by fungi. So today our topic is factors aiding the spread of fungal disease. As we know that, let's suppose a person who is immunocompromised, the immune system is weak. So the chances or the incidence of fungal infections, so they are very high, especially and those individuals who have weak immune system. Another one is acquired immune deficiency syndrome. For example, if a patient is having acquired immune deficiency syndrome, or he or she is using broad spectrum antibiotic or chemotherapeutic agent. So these are the contributing factor which aiding the spread of the fungal diseases. Okay, so now come toward the antifungal drugs, which is classified into two categories. One is systemic antifungal, while the second one is topical antifungal. Systemic antifungal, they are further divided into three groups. The first one is azole antifungal, while the second one is ketoconazole antifungal. So while other antifungal agents, they are also used. While a topical antifungal agent, they are further divided into two. One is azole topical antifungal, while the second one is other antifungal, or you can say topical antifungals. Azole antifungal agents, it may be synthetic antifungals, broad spectrums, fungistatic and fungicidal drug, and the most commonly used that are classified as Amidazole and Triazole. Like Amidazole, so how we can differentiate between Amidazoles and Triazole pharmacologically? So Amidazole contains 2 nitrogens and its structure, while the Triazole has 3 nitrogen and its structure. This is the general classification. You can see here on my screen. That is azole antifungal. One is Amidazole, the second one is Triazole. So Amidazoles is further, it include bifenazole, butoconazole, clotrimoxazoles, and econazole, pentaconazole, isoconazole, ketoconazoles, meconazoles, and omoconazole, oxyconazole, and cetoconazole, and sulcoconazole, and ticonazole. So it is not necessary that all these brands must be available in the market. There are some agents which are commonly used, like we can take the classical example, that is Clotrim. So clotrimazole is available in a market by a trade name Clotrims. Amidazole topically, while the second one is ketoconazole. So it is strong anti-fungal activity. So these are actually the agents which are commercial available in the market, and the patients, it become easy for the patient to purchase it. Okay, so the second one is Triazole. So Triazole include albuconazole, efinaconazoles, and efoxyconazoles, and fluconazoles, atroconazoles, and posaconazoles, and profeconazoles. So fluconazoles and atroconazoles, so all these drugs, they are available in the market by different name. So inshallah, then I will discuss it in my next lectures. So as we know that azole antifungal agents, so as we know azoles, they are antifungal agents which are used to treat systemic topical fungal infection, which are less toxic compared to other antifungal, but they may be less effective. We have already conducted a study on these antifungal agents to evaluate or prevalence and comparative evaluation of different antifungal agents like ketoconazole, fluconazoles against Taenia corporus. So that was in vitro analysis, and inshallah once I will also share that lecture with you people, especially all my viewers who are watching my lectures on routine basis. Now come toward the therapeutic action of azole antifungal agent. So therapeutic actions, you know, are the pharmacological action of these drugs. So the desired and the beneficial action of azole as their direct target is especially sterols or ergosterol. So actually this drug is trying to bind to the sterol and cause cell death or interfering with the cell replications. This is very easy to understand. For example, let's suppose if we are going to destroy the fungi. So as we know that there are some special type of proteins that is called keratins, or especially you can say sterol. Sterol is the main component which is responsible, or sterols or ergosterols. So actually now what will be happen here, that ketoconazole or fluconazole or atroconazole, so it can directly block or inhibit the action of sterols in the fungal cell wall. As we know that the fungal or the fungal cell wall is composed of sterol, and you know this sterol is the main cause of fungal infections. So in order to reduce its chances of infections, we can use all these agents. So therefore it may also block the activity of human steroids such as testosterone and cortisols. So this is very important, so try to understand, this is very important, that whenever we are using certain type of antifungal agent, so it has some adverse drug reaction, like it may directly or indirectly affect your testosterone level. So that's why it should be used with cautions. As we know that Fluconazole is a new agent which can inhibit also the synthesis of ergosterol, leading to inability of the fungus to form cell wall. So actually this is the mechanism of action or mode of action of these agents. In simple words, terbinafine, which is the best antifungal agent, it can block the formation of ergosterol or sterol, which is the main components which may be the cause of infection. So this terbinafine is used. Terbinafine, you know, this is available in a market by a trade name Terbinafine. So it can be used topically and many and more applications. Okay, so now come toward the pharmacokinetic, that what the body do with the drug. So this is very effective orally. This drug is already very effective in acidic environment at favorable absorptions. It means this drug is fully absorbed in acidic environment, but there is high protein binding. And this drug, especially antifungal agent, they are really distributed. So, but they doesn't cross the blood-brain barriers. These antifungal agents, its metabolism occur in the liver, as I have already discussed this. Most of their drug, they are metabolized in the liver before it's reaching to its systemic circulation, or that is called pass effect. The half-life is 8 to 10 hours. So what does it mean? It means that this drug will achieve its peak plasma concentrations to be reduced 50% half of its original concentration, but that time period, that is 8 to 10 hours. So it means that these antifungal agents it will achieve its therapeutic effect, or you can say in 8 to 10 hours, but its original concentration must be reduced from the required dose which is given to the patient. While the dose is 200 milligram OD or BD, twice, it will depend upon the condition of the patient. Okay, now come to our indications. So azole are also indicated for the following medical treatment, like treatment of candidiasis. Candidiasis, this is fungal infection which is caused by Candida albicans. Cryptococcal meningitis. So as we know that meningitis is caused by bacteria as well as virus as well as fungus. So that depend upon on the conditions. So it may be viral, bacterial or fungal. So that is called, actually the fungal meningitis, that is called Streptococcal. Streptococcal is the name of that fungi which cause infection and the triplet layer of your brain, and that is called what? That is called Streptococcal meningitis. While another one is systemic mycosis and aspergillosis and among others. So this is a simple, you can treat all type of fungal infections. Okay, now what are the conditions and which these drugs are contraindicated? It cannot be used. So that is very simple. You can see each and everything on the screen. That is hepatic dysfunction. For example, whenever there is hepatic, for example, a patient who have liver cirrhosis, or let's suppose hepatitis, as we know that liver is the major organ responsible for metabolism. So it means that the metabolism of that person will be disturbed. So in case of hepatic dysfunction, liver cirrhosis or hepatitis, these drugs, they are contraindicated, you can't use. In case of endocrine or fertility problems, for example, if there is misbalance of testosterone, so which are the male sex hormone which control the secondary sexual character of the male. So it can directly affect the rate of fertilization. So this is very important, and kindly always notice these things which are very important. Okay, ji. Another one is that is pregnancy and lactations. As these antifungal agents, they are also contraindicated. It cannot be used in pregnancy and lactations. There may be chances of adverse drug reaction and other complications. A patient taking drug that can prolong the QTc interval. So we have discussed in our previous lecture. The adverse effects which are reported by the azole, the use of azole may result to adverse effect that is called GI liver toxicity and severe effects on the fetus or a nursing baby. If you remember, so we have already talked about the ADR, adverse drug reaction, that is unpredictable. So 100% GI toxicity may be occur, and there will be severe effects on fetus or a nursing baby. So inshallah, dear viewers, and my next lecture we will discuss about the echinocandin antifungal agent, which is another group. And once again, so I am very thankful to all of you for watching my lecture. So if you have any question regarding my lecture, so I am always available for your services. You can directly contact me through my email. So wish you all the best.